Hey y'all, so I wanted to make a video real quick. Somebody asked me for this a long time ago, but ingrown toenail removal. So, why would we remove a toenail or a partial toenail? So, ingrown toenail removal is not always a full removal of the toenail. It could be a partial removal, and sometimes it has even been ingrown on both sides. So, we could do a partial removal on this side and a partial removal on that side, and just leave the middle nail. Sometimes patients just want the whole nail taken off. So, um, they will present with like it gets pretty inflamed. I mean, like real red, real tender. Sometimes it has pus coming out of it. Sometimes people don't want to get them removed, but 9 times out of 10, if you've had an ingrown toenail removed previously, it will grow back ingrown again. Hopefully, of course, we don't want that, but a lot of times that's what always ends up happening. And eventually, they need to go see a podiatrist to figure out what type of plan they could come up with or what else can be done to prevent this from happening in the future. So, you are going to do a digital block, okay? So you're gonna do bupivacaine and lidocaine. So I like to do 5 of each in a 10 cc syringe. So the digital block is going to go back here, and so you inject here and rub it on down, and then you inject on this side, and then you're going to rub it on down, and then you're going to let that sit for like 15-20 minutes. You're going to go back in the room, because I don't stay in the room. You're going to go back in the room and start messing with it. Ask the patient, okay, does it feel numb? Does it feel numb? So you're going to say yes or no. So then you're going to take your hemostats, okay, and you're going to take the hemostats, and I don't have hemostats, so we're going to act like we have hemostats, and you are going to take it and you are going to open it, and you're going to go up under the nail completely, like to separate it. So you're going to go all the way down to back here with your hemostat, okay, and then they shouldn't feel any pain. So you're going to go all the way down just to kind of like loosen it and break it up or whatever. And so you'll go down, and then you're gonna roll the toenail out, okay? And you'll see like a big chunk. Like some people have a big chunk of toenail come out, and it's like, golly, like how was all that down in there? But they get so much relief from it. So you'll roll it out, and then you'll take your scissors and you'll just cut that piece off. If it's the full toenail, you're gonna go down with your hemostats all the way down, all the way across, all the way across, all the way across until you loosen up the full toenail, and then you're gonna take it and roll the full toenail off. And you don't want to tug because you don't want to cause trauma. I mean, it's already kind of trauma, but you don't want to like force the toenail off. So that's why you want to go and break it up and break it up and break it up. And then I always put them on the antibiotics. So I either do, if there's pus coming out of it, I'm going to do either Bactrim, Clinda, or doxycycline, because those are the 3 antibiotics that are going to treat for staph. If there's no pus, then of course we'll do like Keflex by mouth 4 times a day. Um, that's always my go-to. A lot of people state that it makes them sick, but you have to take it 4 times a day in order to get the effect that it's supposed to give you. A lot of people don't know that. And then we just wrap it up with some Zeroform and some tube gauze, put a little Bactroban ointment on there, and then we have them recheck back in 2 days. And then it takes about 3 to 6 months for the toenail to completely grow back. I always tell them to stay off their foot if they can for at least 24 hours. I've had people who have not, and they've come back like, oh my God, it's just in so much pain. Like it just looks really, really bad. Well, did you stay off it for 24 hours? No, I didn't. Whatever. So that's pretty much it. At first, when I first seen it, y'all, I had got so queasy, but it's really not that bad. Once you do it, excuse me, once you do it yourself, like it's a really neat and fun thing to do. These are some of the skills that I acquired in urgent care, and I love having all these skills. So that is ingrown